When you reach 60 and beyond, your body sends you different signals than it did in your younger years. One of the most frightening experiences you can face is sudden chest pain when you're completely alone. For decades, we've been told that chest pain always means a heart attack, that you should immediately call 911, and that there's nothing else you can do. But medical science has revealed a more nuanced truth that could save your life. Not all chest pain is created equal, especially in mature adults, and knowing how to distinguish between different types of chest discomfort and respond appropriately when you're alone can mean the difference between life and death. Today, I want to share with you a comprehensive guide that every person over 60 should know by heart. This isn't about replacing emergency medical care, but about understanding what's happening in your body, making informed decisions in those critical first moments, and taking life-saving actions when help might not arrive immediately. As someone who has studied cardiovascular health and emergency medicine for years, I've seen too many seniors either panic unnecessarily or, conversely, ignore serious warning signs because they didn't understand what their body was telling them. The reality is that after age 60, your cardiovascular system undergoes significant changes that affect how chest pain manifests and what it means. Your arteries naturally become less flexible, your heart muscle may not pump as efficiently as it once did, and your body's response to stress and inflammation changes dramatically. These physiological shifts mean that the classic textbook symptoms of a heart attack that you might have learned about don't always apply to mature adults. In fact, up to 40% of heart attacks in people over 65 present with what doctors call atypical symptoms, which can include chest pressure rather than sharp pain, discomfort that comes and goes, or pain that's accompanied by symptoms that seem unrelated to the heart. One of the most dangerous misconceptions is that chest pain from a heart attack always feels like an elephant sitting on your chest or a crushing sensation. While this can certainly occur, many seniors experience what feels more like indigestion, a tight band around the chest, or even a burning sensation that might be mistaken for heartburn. The pain might radiate to unusual places like your back, jaw, or even your arms in ways that don't seem connected to your heart. Some people experience what feels like severe fatigue combined with mild chest discomfort, leading them to believe they're simply overdoing it or need to rest. Understanding these variations is crucial because your response in the first few minutes can dramatically impact your outcome. Research shows that the sooner you receive appropriate treatment for a heart attack, the more heart muscle can be saved. This is why cardiologists often say that time is muscle. However, when you're alone and experiencing chest pain, you're faced with a complex decision tree that requires both knowledge and clear thinking under pressure. The first and most important step when experiencing sudden chest pain while alone is to immediately sit down or lie down in a comfortable position. Standing or continuing physical activity when your heart might be under stress can worsen the situation by increasing your heart's oxygen demand. Choose a position where you feel most comfortable breathing, which for many people is sitting upright with their back supported. If you feel dizzy or lightheaded, lying down with your legs slightly elevated can help maintain blood flow to your brain. Once you're in a safe position, the next critical step is to take what I call a rapid self-assessment. This involves quickly checking several key indicators that can help you determine the severity of your situation. First, assess your breathing. Are you having difficulty catching your breath, or does breathing feel normal? Shortness of breath combined with chest pain significantly increases the likelihood that you're experiencing a cardiac event. Next, check your pulse if you're able to do so easily. While an irregular or very rapid pulse isn't always dangerous, when combined with chest pain, it can indicate that your heart is struggling. Pay attention to associated symptoms that often accompany serious chest pain. Sweating, particularly cold sweats that seem disproportionate to your environment or activity level, is a significant warning sign. Nausea or vomiting, especially when it comes on suddenly with chest discomfort, should raise immediate concern. Dizziness, lightheadedness, or feeling like you might faint are also red flags that suggest your cardiovascular system is compromised. One of the most important pieces of information you need to gather during this self-assessment is whether the pain changes with position, movement, or breathing. Chest pain that gets worse when you take deep breaths or move in certain ways is more likely to be related to muscles, ribs, or other non-cardiac causes. However, this isn't a hard rule, so don't assume that pain that changes with movement is automatically harmless. After completing your rapid assessment, you need to make a critical decision about seeking help. If you're experiencing chest pain, along with significant shortness of breath, sweating, nausea, dizziness, or pain that radiates to your arms, jaw, or back, you should call emergency services immediately. Don't worry about being embarrassed if it turns out to be something less serious. Emergency medical professionals would much rather respond to a false alarm than arrive too late to help someone having a genuine heart attack. When calling for help, provide clear, concise information about your symptoms, your age, any medications you're taking, and any relevant medical history such as previous heart problems, diabetes, or high blood pressure. If you take medications for heart conditions, mention this specifically, as it helps emergency responders understand your baseline risk and potential complications. While waiting for help to arrive, there are several important steps you can take to maximize your chances of a good outcome. If you have aspirin available and are not allergic to it, taking a regular strength aspirin can be life-saving during a heart attack. Aspirin helps prevent blood clots from growing larger and can restore some blood flow to blocked arteries. However, only take aspirin if you're certain you're not allergic and you haven't been told by your doctor to avoid it due to bleeding risks or interactions with other medications. Chew the aspirin rather than swallowing it whole, as this gets the medication into your bloodstream faster. If you only have coated aspirin, you can still chew it, though it won't taste pleasant. The goal is to get the aspirin absorbed as quickly as possible, and chewing accomplishes this better than swallowing. If you have nitroglycerin prescribed for heart conditions, you can use it according to your doctor's instructions. Typically, this means placing 1 tablet under your tongue and waiting 5 minutes. If the pain doesn't improve, you can take a second tablet, wait another 5 minutes, and if necessary, take a third tablet. However, if you've taken 3 nitroglycerin tablets over 15 minutes without relief, this suggests a serious problem that requires immediate emergency care. Breathing techniques can be incredibly valuable while you're waiting for help. Slow, controlled breathing helps ensure your body gets adequate oxygen and can help calm your nervous system, which might otherwise make your heart work harder. Try breathing in slowly through your nose for a count of 4, holding for a count of 2, and then exhaling slowly through your mouth for a count of 6. This pattern helps activate your body's relaxation response and can lower your heart rate and blood pressure. Avoid the temptation to lie completely flat if you're having trouble breathing, as this can make breathing more difficult for people with heart problems. Instead, prop yourself up with pillows or cushions so that your head and chest are elevated. This position, sometimes called the recovery position, helps reduce the work your heart has to do and can make breathing easier. Stay as calm as possible, though this is admittedly easier said than done. Panic and anxiety cause your body to release stress hormones that increase your heart rate and blood pressure, potentially worsening your condition. Remind yourself that help is coming and that you're doing everything you can to help yourself. If you're religious or spiritual, this might be a time when prayer or meditation provides comfort and helps keep you calm. If possible, unlock your front door or make sure emergency responders can easily access your home. If you live in an apartment building, consider calling a trusted neighbor who might be able to let paramedics into the building. Don't exert yourself to do this if it means significant physical activity, but if you can manage it safely from where you're sitting, it can save valuable time when help arrives. One crucial point that many people don't realize is that chest pain doesn't always indicate an immediate emergency, even in people over 60. Conditions like costochondritis, which is inflammation of the cartilage connecting your ribs to your breastbone, can cause significant chest pain that worsens with movement or deep breathing. Muscle strains in the chest wall, perhaps from coughing, lifting, or even sleeping in an awkward position, can create pain that feels alarming but isn't life-threatening. Gastroesophageal reflux disease, commonly known as GERD or acid reflux, becomes more common as we age and can create chest pain that's remarkably similar to heart pain. This is because the esophagus and the heart share similar nerve pathways, so irritation in the esophagus can be felt as chest discomfort. GERD-related chest pain is often burning in nature and may be accompanied by a sour taste in your mouth or the sensation of food coming back up. Anxiety and panic attacks can also cause chest pain, especially in people who are dealing with health concerns or major life changes that often accompany aging. The chest pain from anxiety is usually sharp or stabbing, may come and go quickly, and is often accompanied by feelings of doom, rapid heartbeat, and difficulty breathing that feels like you can't get a deep breath. However, the challenge with these non-cardiac causes of chest pain is that they can occur alongside or even trigger actual heart problems in vulnerable individuals. The stress of severe acid reflux, for instance, can potentially trigger a heart attack in someone with underlying coronary artery disease. This is why it's so important to err on the side of caution, especially when you're alone and over 60. If you determine that your chest pain might not be cardiac in nature, there are still important steps to take while you're alone. For suspected muscle or rib-related pain, gentle movement and stretching might provide relief, but avoid anything that significantly worsens the pain. For possible acid reflux, sitting upright and sipping small amounts of water might help, though avoid eating or drinking large quantities in case you do need emergency treatment. Even if you decide not to call emergency services immediately, it's important to have a plan for getting help if your condition changes. This might mean calling a family member, trusted friend, or neighbor who could check on you or take you to urgent care if needed. Don't try to drive yourself anywhere if you're experiencing chest pain, as this puts both you and others at risk. Consider keeping a record of what you were doing when the chest pain started, how it felt, how long it lasted, and what made it better or worse. This information can be valuable for healthcare providers, whether you end up in the emergency room that day or see your doctor later. Include details about any medications you took and their effects. Prevention strategies become increasingly important as we age, and understanding your personal risk factors can help you make better decisions when chest pain occurs. If you have a history of heart disease, diabetes, high blood pressure, high cholesterol, or if you smoke or have smoked, your risk of chest pain being cardiac in nature is higher. Family history of heart disease, especially in immediate family members who had heart attacks at relatively young ages, also increases your risk. Regular cardiovascular checkups become crucial after 60, not just for prevention, but also for establishing baseline measurements that can help you and your healthcare providers interpret symptoms when they occur. Knowing your normal blood pressure, heart rate, and cholesterol levels can provide context for symptoms and guide treatment decisions. Lifestyle modifications can significantly reduce your risk of serious cardiac events, which means less likelihood of facing emergency chest pain situations while alone. Regular physical activity appropriate for your fitness level and health conditions strengthens your heart and improves circulation. Even gentle walking for 20 to 30 minutes most days can provide cardiovascular benefits, though you should consult with your healthcare provider before starting any new exercise program. Nutrition plays a crucial role in heart health, particularly as we age. A diet rich in omega-3 fatty acids from sources like fish, nuts, and seeds supports cardiovascular function. Limiting sodium intake helps control blood pressure, while adequate potassium from fruits and vegetables supports healthy blood pressure and heart rhythm. Staying well hydrated is also important, as dehydration can strain your cardiovascular system and potentially trigger chest pain episodes. Stress management becomes increasingly important with age, as chronic stress contributes to cardiovascular disease and can trigger acute cardiac events. Techniques like deep breathing, meditation, gentle yoga, or even regular social interaction can help manage stress levels. Adequate sleep is also crucial, as poor sleep quality has been linked to increased cardiovascular risk. Medication management is particularly important for people over 60, as many take multiple medications that can interact with each other or affect cardiovascular function. Regular medication reviews with your healthcare provider can identify potential problems before they become serious. If you take medications for heart conditions, make sure you understand how and when to use them in emergency situations. Having an emergency plan in place before you need it can make all the difference when you're alone and experiencing chest pain. This plan should include having emergency phone numbers easily accessible, keeping a current list of your medications and medical conditions in a visible place, and ensuring that at least one trusted person knows about your health conditions and has a key to your home, or knows how to access it. Consider investing in a medical alert system if you live alone and have risk factors for cardiac events. These systems have evolved significantly and now include options that work both inside and outside your home, with some featuring automatic fall detection and GPS location services. While no one wants to think about needing such a device, having it available can provide peace of mind and potentially save your life. The emotional aspect of experiencing chest pain while alone shouldn't be underestimated. Fear and anxiety are natural responses, but they can cloud your judgment and make it harder to take appropriate action. Practice relaxation techniques when you're feeling well so that you can use them effectively if you ever need them during a medical emergency. Building a support network becomes increasingly important as we age, not just for emergencies, but for overall health and well-being. This might include family members, friends, neighbors, or even members of community organizations. Having people who check on you regularly means that if something serious happens, someone is likely to notice relatively quickly, even if you're unable to call for help yourself. Technology can also be your ally in managing health emergencies when you're alone. Smartphone apps can store medical information that emergency responders can access even from a locked phone. Some apps can automatically detect falls or other medical emergencies and summon help. While these shouldn't be your only safety net, they can provide an additional layer of protection. Understanding the limitations of self-assessment is crucial for making good decisions about chest pain when you're alone. While the guidelines I've shared can help you distinguish between different types of chest pain and respond appropriately, they're not a substitute for professional medical evaluation. When in doubt, it's always better to seek help and be told you're fine than to ignore potentially serious symptoms. Remember that heart attacks in people over 60 can present very differently from the classic symptoms you might expect. Women, in particular, often experience more subtle symptoms that might be dismissed as something else. These can include fatigue, shortness of breath, nausea, or pain in the back or jaw without significant chest pain. Trust your instincts if something feels seriously wrong, even if your symptoms don't match what you think a heart attack should feel like. The key to successfully handling sudden chest pain when you're alone after 60 lies in preparation, knowledge, and the wisdom to act decisively when necessary. By understanding the different types of chest pain, knowing the warning signs that require immediate action, and having a plan for getting help, you can face this frightening situation with confidence and maximize your chances of a positive outcome. Your health and safety are worth every precaution, every preparation, and every moment of attention you can give them. The steps you take today to understand and prepare for potential health emergencies could very well save your life tomorrow. Take the time to review your emergency plans, update your medical information, and ensure you have the tools and knowledge you need to protect yourself when you're on your own.